Have you ever considered whether your daily bath could be doing more harm than good? For many of us over the age of 65, what seems like a simple, soothing routine could be putting our health at serious risk. In this video, we are going to uncover 5 shocking truths about bathing that might completely change the way you care for your body as you get older. It may surprise you to learn that taking hot baths can put a strain on your heart, dry out your skin, and even lead to dangerous falls in the bathroom. But don't worry, this video is not just about the dangers. I'm here to share practical life-changing tips that can help you bathe safely, protect your skin, and even improve your sleep. These insights come from over 40 years of clinical experience working with older adults just like you. Throughout this video, I'll provide essential information about why frequent bathing can weaken your skin's natural defenses, making you more susceptible to infections. I'll also reveal key steps to take in order to avoid slipping and falling while bathing, a common yet often overlooked risk for seniors. Plus, I will show you how managing your body's temperature after a bath can improve your overall health and well-being, offering a simple solution to enhance your daily routine. By the end of this video, you'll have the knowledge and confidence to make smarter choices when it comes to bathing, helping you improve your physical health and overall quality of life. So, stick with me and let's dive into these life-changing truths. Your health and safety depend on it. If you haven't already subscribed, make sure to hit the subscribe button and activate the notification bell so you never miss a video. Your support means so much to me, and if you found this video valuable, I'd love for you to help spread these lessons by liking and sharing it with others. And if you like the topic of this video, please comment 1 below. If you don't, feel free to comment 0, and let me know how I can improve and create better content for you. Now, let's get started. Truth number 1. Hot baths put your heart at risk. Have you ever wondered what happens to your body when you soak in hot water? Well, after working as a physician for over 40 years, I've seen firsthand how hot baths can affect seniors. When older adults bathe in hot water, their blood vessels expand rapidly, which can cause a sudden drop in blood pressure. This drop, especially for those over 65 with high blood pressure or heart conditions, can lead to dangerous, or even fatal, consequences. In my clinic, every winter, I treat at least 10 elderly patients who faint during a bath. One of my patients, 90-year-old Mr. Thomas, had been taking hot baths daily for more than 60 years. He used to proudly tell me, "Dr. Wilson, I've stayed healthy because I take a hot bath every day." Unfortunately, one winter morning, he collapsed from a heart attack while in the bath. Thankfully, his family found him in time, and he survived, but he spent several weeks in the ICU recovering from the ordeal. Medically speaking, after the age of 65, the autonomic nervous system, which helps regulate your body's response to temperature change, begins to decline. This makes it harder to adapt to sudden temperature shifts. When stepping out of a hot bath, a rapid drop in blood pressure, known as orthostatic hypotension, can occur, making you feel lightheaded or faint. For those over 65, bathing in water hotter than 106 degrees Fahrenheit 41 degrees Celsius for more than 15 minutes can increase the strain on your heart by 20 to 30%. That's the equivalent of your heart working as hard as it would during a light jog. But don't worry, there are safe ways to bathe without risking your heart health. I'm here to share tips from my 40 years of clinical experience. Keep the water temperature between 100 degrees Fahrenheit and 104 degrees Fahrenheit, 38 to 40 degrees Celsius. To ensure it's safe, test the water with the back of your hand. It should feel comfortable, not scalding. Limit your bath time to no more than 10 minutes. Research shows that this is the optimal amount of time to enjoy a bath without putting unnecessary strain on your cardiovascular system. Stay hydrated. Drink plenty of water before and after your bath to help maintain your blood pressure and prevent dehydration, which can exacerbate drops in blood pressure. Consider using a chair in the bathroom. Showering while seated greatly reduces the risk of falling, which is especially important as you age. Never bathe alone if possible. If you're over 80, it's wise to have someone nearby in case of an emergency. Having a trusted friend or family member nearby can make a world of difference if something goes wrong. Truth number 2. Daily bathing dries out your skin. After treating thousands of elderly patients over my 40 years as a physician, I've seen firsthand how daily bathing can severely dry out the skin as we age. As we get older, our skin's natural lipid production drops significantly. By the time we reach 65, the amount of lipids, the oils that help keep our skin moisturized, in our skin is often just half of what it was when we were in our 20s. This natural decrease in skin oils means that when we bathe in hot water every day, we're stripping away the very moisture our skin needs to stay healthy. Just last month, a 78-year-old patient of mine, Mrs. Susan Harris, came to see me in my clinic. She had been struggling with severe itching every night, which kept her awake. After she bathed, her skin became so dry that it felt like it was pulling apart. Upon examination, I discovered her skin was cracked and extremely dry all over. She explained, "Dr. Wilson, I love staying clean, and I scrub every inch of my body with soap every day. Was I doing something wrong?" Unfortunately, the answer was yes. For older skin, daily use of soap can be harmful because it disrupts the natural protective barrier. I conducted a study with my colleagues, who are dermatologists, and found that seniors over 65 who used soap more than 4 times a week had a 60% higher rate of skin dryness. Dry skin isn't just uncomfortable, it causes itching, and the more you scratch, the higher your risk of infections. I've seen patients hospitalized for bacterial infections that started with scratching irritated skin after a bath. So let's talk about how to keep your skin healthy and hydrated as you age, based on what I've learned over decades of practice. Cut back on daily bathing. I recommend limiting your baths to just 3 times a week to allow your skin's natural lipids to recover and maintain their barrier. Use soap only where it's needed. Focus on areas like your armpits, groin, and feet where odor tends to build up. Avoid using soap all over your body, as this will help preserve your skin's natural moisture. Opt for a mildly acidic soap or cleanser with a pH of 5.5 to 6.0. Regular soap is often too alkaline and can strip your skin of moisture, making dryness worse. Look for cleansers that are gentle on your skin and won't dry it out. If you are still watching this video and find these lessons useful, please comment 1 below to let me know that you are still here with me. Apply a good moisturizer within 3 minutes of bathing. This golden 3 minutes is critical because it locks in moisture and prevents your skin from drying out. Make sure to moisturize while your skin is still damp. Choose moisturizers with ingredients like ceramides or hyaluronic acid. These ingredients are incredibly effective at keeping your skin hydrated. Ceramides form a protective barrier on your skin, while hyaluronic acid acts like a sponge, drawing moisture into the skin and keeping it there. You'll find products containing these ingredients at any pharmacy or online. Look for products labeled Skin Barrier Strengthening or Moisture Retention. These products often contain the best ingredients for your skin. You don't need to check the full ingredient list. Just look for these key terms on the packaging. Mrs. Harris took this advice to heart, and after just 2 weeks, her itching had decreased by 80%. She was finally able to sleep peacefully again, without the constant discomfort that had been bothering her for months. Truth number 3. Falling in the bathroom is hard to recover from. One of the most common injuries I see in my clinic among seniors is falls that occur in the bathroom. Over my 40 years as a physician, I've treated hundreds of elderly patients who've had accidents while bathing. Just last winter, I had an 88-year-old patient, Mr. Robert Johnson, who slipped while getting out of the tub after his bath and fractured his hip. He was rushed to the emergency room, and while his surgery was successful, his recovery was long and painful. Unfortunately, his mobility declined significantly afterward, and his overall quality of life dropped. According to statistics, about 38% of bathroom falls in individuals over 65 occur either during or immediately after bathing. This is a very real risk that we cannot ignore. Even more alarming is the impact that these fractures can have on seniors' health. A study conducted by Severance Hospital found that 25% of seniors over the age of 80 who suffer a hip fracture will pass away within a year. That's 1 in 4. This is a serious issue that can have life-threatening consequences. But why do falls happen so frequently among older adults when bathing? There are a few key factors. First, the bathroom surfaces are often slippery due to water on the floor. Second, hot water can cause temporary dizziness by lowering blood pressure, making it harder to maintain balance. Third, as we age, our balance and coordination naturally decline, which increases the risk of falls. But don't worry, there are several ways you can reduce this risk and make your bathing routine much safer. Here are some safety measures that can make a huge difference. Place non-slip mats on the bathroom floor. This is one of the most cost-effective safety measures you can take. It prevents slipping on wet surfaces, reducing the risk of falls right in the bathroom. Install grab bars near the tub and toilet. Grab bars are an essential safety feature for seniors. They can help you stabilize yourself when getting in or out of the tub or using the toilet, and they can save lives in the event of a near fall. Consider using a bathroom chair. Showering while seated can reduce the risk of falling by over 90%. Not only does it make showering much safer, but it also reduces the strain on your joints and muscles, making the experience more comfortable. Move slowly before and after bathing. Sudden movements or standing up too quickly can cause dizziness and increase the risk of falling. Always give yourself time to adjust before standing up or getting out of the tub. Get help if possible, especially if you're over 80. Having someone nearby while bathing is a smart precaution. If you're alone, you could fall without anyone around to help, so it's always safer to have a family member or caregiver available to assist you, especially if you're 80 or older. Mr. Johnson, after experiencing his fall, took all these safety measures to heart. He installed non-slip mats, added grab bars, and now uses a shower chair. He also makes sure to take his time when moving before and after bathing. He reports that these simple changes have not only made him feel much safer but have also made showering a more comfortable experience. He now prefers sitting down to bathe, and he hasn't had any accidents in over a year. Truth number 4. Post-bath temperature management is critical. As we age, our bodies lose some of their ability to regulate temperature effectively. Research shows that people over the age of 80 experience about 40% less ability to handle temperature changes compared to younger adults in their 20s. This makes it more difficult for older adults to adapt to sudden temperature shifts. When you take a hot bath, your body's temperature rises, but the danger comes afterward when it can drop very quickly, and that's when the risk increases. I recall treating a 92-year-old patient, Mrs. Eleanor Smith, last winter. She had taken a warm bath but didn't dry off properly before entering a cold room. Within hours, she was in the emergency room with hypothermia. Her body temperature had dropped to a dangerously low 94.1 degrees Fahrenheit, 34.5 degrees Celsius. Her family couldn't understand how this could happen, given that she had just taken a warm bath. The answer is straightforward. After a hot bath, your blood vessels expand to release heat, but when you move into a cold environment, those expanded blood vessels cool quickly. It's similar to putting a cup of hot water into a cold fridge. It cools down rapidly. So, what can you do to prevent such a dangerous situation? Here's my prescription for managing your body temperature safely after a bath. Warm up the bathroom beforehand. It's a simple but effective way to minimize temperature swings. Keeping the room warm will help your body adjust more smoothly after you leave the bath. Dry off completely with a warm towel. Any leftover water on your skin will evaporate and steal your body heat. To prevent this, always dry off thoroughly with a warm towel right after bathing. Put on warm clothes immediately after your bath. Make sure to cover up quickly to preserve your body heat, and don't forget to dry your hair as well. Wet hair can lead to rapid heat loss. Drink a warm beverage afterward. Sipping on a warm drink like herbal tea or hot water helps maintain internal warmth and stabilizes your body temperature. Choose to bathe between 2 p.m. and 4 p.m., when temperatures are typically warmer. In the afternoon, the outside environment is usually warmer than early mornings or evenings, so this is the safest time to bathe, especially in the colder months. Since Mrs. Smith started following these tips, she hasn't had any issues with temperature regulation after her baths. She now bathes safely, and it's made a significant difference in her well-being. Managing temperature isn't just about comfort, it's about survival for seniors. It's one of those small changes that can make a huge impact on your health and safety. Truth number 5. Being too clean can make you more prone to colds. We've all been taught that cleanliness is crucial to good health, but is that always the case? Numerous studies have shown that excessive hygiene can harm your health, especially as we age. Our skin is home to a variety of beneficial bacteria, collectively known as the skin microbiome. These bacteria play an important role in protecting us from harmful germs and pathogens. However, when we wash our skin with soap every day, we wash away these helpful bacteria. When we're younger, our skin can recover quickly from the loss of these bacteria, but after the age of 65, our skin's ability to regenerate slows down. In a recent study I conducted in collaboration with a microbiologist at Stanford University, we found that seniors over 75 who bathed with soap every day had 35% lower skin immunity compared to those who bathed only 3 times a week. One of my patients, 83-year-old Mrs. Evelyn Thompson, was a perfect example of this. She had spent her entire life washing her body with soap every single day. She would often tell me, "Dr. Wilson, my secret to staying healthy and living so long is cleanliness." Yet, every winter, she came to my clinic with recurring skin infections. The bacteria from these infections often entered through tiny cracks in her dry, fragile skin, a direct result of her weakened skin defenses from overwashing. To make matters worse, another study we conducted showed that seniors who bathe daily are more likely to experience upper respiratory infections as well. This is because the health of your skin is closely linked to your immune system, including your respiratory immunity. If you are still watching this video and find these lessons useful, please comment 2 below to let me know that you are still here with me. So, how can you stay clean and hygienic while still protecting your skin's immune system? Here are some tips based on my research and experience. Limit bathing to 2 to 3 times a week. This gives your skin time to recover and maintain its natural protective barrier. Avoid using antibacterial soaps or body washes. These products don't just kill harmful bacteria, they also wipe out the good bacteria that protect your skin. Many antibacterial products contain ingredients like triclosan, which can weaken your skin's immune defenses over time. Instead, opt for regular moisturizing soap or mildly acidic cleansers. Look for products labeled low irritation, moisturizing, or mildly acidic on the packaging. Use soap only on areas that tend to get smelly, like your armpits and groin. For the rest of your body, simply rinse with water. This helps preserve your skin's natural balance and reduces the risk of drying it out. Maintain a humidity level of 40 to 60% indoors. Dry air can disrupt the balance of skin bacteria, making it harder for your body to defend against infections. A humidifier can help keep your skin from drying out, especially in winter. Mrs. Thompson followed these guidelines for a year, and since then, she hasn't had a single skin infection. At 83, her skin has remained healthy and free from irritation. She now enjoys the benefits of healthier skin without overwashing it. Addressing misconceptions about cleanliness and sleep. By now, you may still be wondering, but if I don't bathe every day, won't I feel dirty? Won't I need a hot bath before bed to help me sleep? Let's briefly address these common misconceptions. From both my research and personal experience, I can tell you that for those over 65, daily bathing does more harm than good. It's not just my opinion, it's a medical fact. But why do so many older adults still feel the need to bathe every day? For many seniors, daily bathing is a deeply ingrained habit that stems from their upbringing. They lived through times when clean water was scarce, and hygiene-related diseases spread quickly. This left them with a lasting sense of trauma around cleanliness. For some, it became a matter of pride and respect for others. They want to appear fresh and presentable at all times. I've treated a 93-year-old patient, Mrs. Mildred Clark, who bathed twice a day because she feared that her grandkids might comment, "Grandma smells," if she didn't. Sadly, this daily routine led her to collapse from exhaustion due to overexertion. Some seniors are also anxious about feeling dirty if they skip a bath, even if they don't need one. Many of my patients have told me they can't fall asleep unless they take a bath first, because their bodies feel sticky, even though they've already maintained good hygiene throughout the day. Here's how to ease their concerns and foster healthier habits. Changing long-standing habits, especially when it comes to something as ingrained as daily bathing, can be a challenge. However, it's important to help seniors understand that bathing 3 times a week is more than sufficient to maintain cleanliness. A study from Harvard Medical School found no significant difference in skin bacteria levels or infection rates between seniors who bathe 2 to 3 times a week and those who bathe daily. The key is managing odor without over-cleansing. Many seniors worry about feeling unclean if they don't bathe daily. However, odor can be effectively managed without the need for a full bath. A simple routine of washing areas that tend to get the most odor, such as the armpits, groin, and feet, daily is usually all that's necessary. I recommend a combination of daily partial washing, along with 2 to 3 full baths a week. Over 90% of my patients report that this keeps them feeling fresh and clean. To make this transition smoother and less stressful, you can try a gentle conversation. For example, you might say, "Mom, I recently saw a TV segment with a geriatrics expert who's been practicing for 40 years. He explained that as we age, our skin changes, and bathing too often can dry it out and weaken our immune system. Maybe we could give their recommended method a try." In addition to adjusting bathing habits, I also recommend considering alternatives that can help replace the relaxation of a daily bath. Gentle massages, wiping down with a warm towel, sponge baths, or even aromatherapy are all great ways to promote relaxation and cleanliness without drying out the skin. One of my 85-year-old patients, Mrs. Clara Thompson, switched to wiping her body with a warm towel infused with lavender oil. She found it less drying, the scent was soothing, and most importantly, it left her feeling just as clean and refreshed as a full bath. Remember that change doesn't happen overnight, especially when it comes to lifelong habits. Gradually reducing the number of baths per week is a good approach. One of my 78-year-old patients, Mr. Harold Kim, started with 6 baths a week, then slowly decreased it to 5, and eventually 3. Within 3 months, he had fully adjusted to bathing just 3 times a week, and he reported significant improvements in his skin and overall health. If you have friends, family, or colleagues over the age of 65 who still bathe daily, I encourage you to share this information with them. It could potentially save their health and their life, particularly during the winter months when bath-related accidents are most common. Addressing misconceptions about bathing and sleep. If you are still watching this video and find these lessons useful, please comment 3 below to let me know that you are still here with me. Now, let's talk about another common misconception: the idea that a hot bath before bed helps you sleep better. While this may be true for younger people, it's not as effective for seniors. For younger individuals in their 30s and 40s, a hot bath helps lower the body's temperature afterward, which triggers melatonin production, a natural sleep aid. However, the situation is different for those over 65. In a sleep study I conducted with 200 seniors over the age of 75, we found that those who took a bath in water hotter than 106 degrees Fahrenheit 41 degrees Celsius 2 hours before bed had poorer sleep quality. They experienced 42% more wake-ups during the night, and their deep sleep was reduced by 38%. The reason for this is simple. After years of research, I've learned that seniors' ability to regulate temperature weakens as they age. After a hot bath, their body has a more difficult time recovering, which disrupts their sleep patterns. One of my patients, 82-year-old Mrs. Alice Lee, had been taking hot baths before bed her entire life but struggled with insomnia for years. After following my advice to switch to lukewarm water, around 100 degrees Fahrenheit or 38 degrees Celsius, for 5 to 10 minutes, 3 hours before bed, her sleep quality dramatically improved. So, what's the ideal bathing routine for seniors to sleep well? Here's what I recommend for seniors to enjoy a restful night's sleep. Keep the water lukewarm, around 100 degrees Fahrenheit 38 degrees Celsius. Avoid very hot water, as it can interfere with sleep quality. Limit your bath time to 5 to 10 minutes. Anything longer can exacerbate temperature fluctuations, disrupting your body's ability to relax. Aim to bathe 3 to 4 hours before bed. Bathing too close to bedtime doesn't allow your body enough time to cool down, which can interfere with your sleep cycle. Drink a warm herbal tea afterward. A calming beverage like chamomile or peppermint tea can naturally relax your body and help stabilize your internal temperature. Try a foot soak instead of a full bath. If you prefer to relax before bed, a lukewarm foot soak can be just as effective as a full bath, without the risks associated with temperature fluctuations. One of my 78-year-old patients, Mr. James Park, had struggled with insomnia for over 20 years. After switching from hot baths to lukewarm foot soaks 3 hours before bed, he experienced deep, restorative sleep for the first time in decades, without the need for medication. Sleep is vital to senior health. By adjusting your bathing routine to match your body's needs, you can achieve better sleep and avoid the risks associated with extreme temperature changes. We've covered a lot of important information today, from the surprising risks of hot baths to the simple but powerful changes you can make to your bathing routine for better health and safety. So, what have you learned so far? Think about one thing you can apply to your life starting today. Whether it's reducing your bath frequency, managing your skin's health, or taking better precautions to avoid falls in the bathroom. Please take a moment to comment below and share one thing you've learned and will start practicing in your own life. I'd love to hear your thoughts and how these tips are helping you make positive changes. If you enjoyed this video, please leave your comment below, and don't forget to like, share, and subscribe to our YouTube channel so you never miss out on helpful tips for living your healthiest and happiest life. Thank you for watching, and I'll see you in the next video.